Knee replacements these days are really good. The components are expected to last about 25 to 30 years, and they move like a real knee so much better than they used to. So people go back to doing a much higher level of active and athletic lifestyle after recovery. But to allow this to heal properly so you can get back to doing what you love, give yourself permission to take things slowly at first. We don't recommend an aggressive regimen of strengthening exercises the first 6 weeks. A total knee replacement takes about 9 months to completely heal. The first 2 weeks are typically the most painful because your body is going to ramp up and down through the inflammatory phase as it responds to the trauma of the surgery. So you have more pain, swelling, and that usually peaks around day 7. So for that reason, we have a very basic regimen of exercises for you the first 2 weeks. Even if the exercises feel too easy, that's exactly what we need for you to do. It keeps you in a therapeutic range of activity, not too much, not too little. Remember to use your walker during this time to take some of the workload off the knee and let the inflammation decrease more quickly. During the first 6 weeks, your body needs time to build a good foundation of healing. The bone needs a good 6 weeks to bond to the textured surface on the underside of the implants where they contact the bone. As the bone heals, it grows into the texture of the implant, making a strong fusion. The soft tissue also needs a full 6 weeks of healing so it can tolerate a lot more force and stabilize the joint. You're still allowed to put full weight on the operative side unless your surgeon specifies otherwise. You only have about 3 months to get your range of motion before scar tissue buildup is enough to potentially limit any additional gains. We talk about range of motion more in another video. Your window of time to get your range of motion is about 3 months, but there is no window of time to gain strength, so the focus is more on range of motion and less on strengthening during the first 6 weeks. If you're focusing too much on strengthening the first several weeks, then you're going to provoke a higher level of inflammation, swelling, and pain. That's going to decrease your ability to get your range of motion during the first 3 months of your program when it's typically the easiest. Exercises during the first 6 weeks can seem very boring, and you can feel like you're not doing enough. You might feel like doing so much more than what your knee is actually able to tolerate. Your pain might be very low, but the bone and soft tissue have not healed up enough to tolerate the forces of normal activity. Just remember, you're allowing your knee to heal properly so the bone can fuse to the implants and the soft tissue can tolerate normal force without damage. Now, your pain might be higher than expected. It's not usually a sign of a complication, but keep up with your scheduled follow up visits with your surgeon. If you feel there might be something wrong, contact your surgeon's office. Complications are rare, but they do happen sometimes. It's better to have it evaluated sooner than later. Just remember, there's a wide range of normal in the first several weeks after surgery when it comes to pain, strength, activity tolerance, and so forth. Everyone heals at their own pace. After 6 weeks, even though you still have more healing time to take place, you can usually start to increase your activity in much larger increments. This is the point where you get back to the driving range or the golf course, take some swings with the tennis racket, get back into the pool, or go to the gym. Your new exercises after 6 weeks will also ramp up to a more appropriately challenging level. Remember, this process is a marathon, not a sprint, so give your body a chance to heal, and that's going to set you up for success in the long run and avoid any self inflicted complications from overdoing it.